Hatteras. I'm the founding medical director of the North Island Community Health Centre along with Dr. Howie Lee. We started the centre with and have since had 0 taxpayer dollars. Better is possible. Today we'll have a chance to listen to a number of different exceptional speakers and all of your elected representatives, from your Mayor, Pat Corbett-Labatt, to your Member of the Legislative Assembly, Dr. Anna Kindy, and the Member of Parliament, Aaron Gunn. We're also going to hear from Dr. Priyan Armagan, who's running the Emerge in Port McNeill right now, so he couldn't be here, but sends his best. And so I'd like to begin by welcoming, and I'm looking for him, there we are, Chief David Knox, and very grateful to have Chief Knox here today to say a few remarks on the land acknowledgement.
Welcome to the land of the Quagil. On Vancouver Island, we got Cosalis, Nuchanos, the Kwakwakiwak. We're the Kwakwakiwak from the north end, Comox to Smith's Inlet. Collectively, our history through time immemorial is carbon dated 14,500 years. That's over 700 generations. Our beautiful country, Canada, is turning 168 years old this year. I love the Canadians. It's a government, the crown, shame on you. It's so important to collectively work together, to look at the future. We're all not going nowhere. We got to work together. There's so many variables to this onion. Our health, our wellness is so important. We as people of the land, we've inherited historical intergenerational trauma that was put on us at contact. How do we make soul round to make it right? It's to work together. So my message to Josie Osborne and the federal government, we got to open up our ER. We, the North Islands, are suffering of wide political differences within all levels of government realm. But we got to get vocal, North Island. Collectively, this is our island, our tip. We got to work together no matter what. We got the good, the bad, the ugly, and the yeah. But how do we work together? Let's just make it right for the future. It's not about us at this moment. It's about for those yet unborn. And there's so much more to talk about. I'm going to try not to be too long-winded. But the bottom line, we got to open up our ER in Port Hardy because a lot of our community is suffering without it open in the evening. We need 24 hours a day, not from 7 till 5 p.m. Sorry, Ministry of Health, that doesn't cut it. Our people are suffering through intergenerational trauma, alcoholism, suicide, opioids at its worst level right now. So how do we make it right? It's for all of us to work together to get vocal and to make it right for all the future. Gaelic Isla.
Thank you very much, Chief Knox. Now I'd like to welcome the honor of presenting our Member of Parliament, Aaron Gunn. And Aaron has been on the North Island twice in the past week, and he's been in Ottawa, so way to go.
Very much. I don't know how I'm going to follow that. I don't think you were using the mic there, Chief. You definitely didn't need it. That was quite something, very empowering, and thank you very much for that. As your federal representative, obviously healthcare is primarily provincial, so I'm going to be reasonably brief, but it's still, first and foremost, my number one duty to be your guys' voice and to use my platform to deliver messages from the community, and this is obviously a very important message from the community. It's been nearly 3 years where Port Hardy has been forced to do without what most communities in Canada take for granted. That's 34 months of uncertainty, 34 months of closures, 34 months of families wondering what will happen if their child gets sick at 2 a.m., if a parent of theirs has a heart attack or they themselves need urgent care. I hear stories of people having to drive in the middle of the night, 2, 3 a.m. to Port McNeill. Up here in the North Island, those can be long, dangerous roads. Those are additional risks, and those risks, in my view, and I think of the view of most people here, should not be acceptable. I think there's one point that I know Dr. Kindy really wants to emphasize, and I want to emphasize as well, is delayed care is compromised care. And right now, without an overnight emergency room, without a fully staffed 24/7 emergency room, that is delayed care, that is compromised care, and I think that is completely unacceptable, and you are all right to be outraged and to be demanding more from your government. I know Island Health, there's been lots of promises of progress, of new equipment, of new staff. I know there are some new medical staff up here in the North Island who are doing an amazing job, and yet here we are still without the overnight emergency room. And in my view, in the North Island, the governments in Ottawa, but especially in Victoria, take so much money in stumpage, in royalties, in revenues, take it all away, and they give just a fraction of it back. And I think, given that context, the fact that they can't even provide enough to give you what most communities, as I said, take for granted, is totally unacceptable. So what I'm going to do, as much as I can, is to be one of your guys' voices to amplify this issue, to work with your MLA and the member of the Legislative Assembly, Dr. Anna Kindy, to pressure the government, to pressure Island Health to get you the care that you work hard for and that you deserve. So thank you so much for organizing this, and I really appreciate it. Shows so much community spirit here in Port Hardy, and also, on a positive note, unbelievable Christmas celebration that you had last night that the mayor and the council put together. So thank you everyone for having me.
And some of you may know that Aaron, prior to his career as a member of Parliament, was very involved producing videos. He produced a fantastic video on the healthcare system. He actually came and interviewed us. He did a tour of the North Island Community Health Centre before it was even open. So it was kind of special to get to show him today what we've produced and what we've done in the past 3 years. Next, I would like to introduce, we have the great support of our Chamber of Commerce. I got from the head of the Chamber of Commerce a note last night. She couldn't be here, but all the businesses in Port Hardy are behind us and pushing to reopen the Emerge 24/7. And we've also, last minute, had someone step up. We've got Liam Patey from Applewood GM, the manager. He's here. He's shown amazing support in our push to reopen our Emerge. And I'd like to welcome his wife and colleague, Kayla, to come read a statement on behalf of Dr. Anna Kindy, who's in the legislature today in Victoria and sends her regrets for not being able to come. Thank you very much, Kayla.
Good afternoon, everyone, and thank you so much for being here. Again, my name is Kayla Burley, and I have the honor of speaking on behalf of MLA Dr. Anna Kindy for North Island today, as she is unable to join us in person. Port Hardy needs and deserves 24/7 emergency access. My husband, Peter Olson, and I worked in Port Hardy in 1990 and 1991. We were covering the emergency department and admitting patients for acute care when appropriate. It was really rewarding work with super appreciative patients. Port Hardy is a beautiful spot with so much to offer. That experience is largely why we left Vancouver to live and work on the North Island in Campbell River. We have both done 8 outpatient clinics in Port Hardy over the past 28 years. Now going on almost 3 years, Port Hardy's emergency department has been closed after 5 p.m. This is unacceptable. Lack of access to this care is dangerous. Delayed care is compromised care. People in Port Hardy deserve an emergency department that's open 24/7. Having to travel to Port McNeill for care puts people's lives at risk. It also puts frontline healthcare providers in Port McNeill in a burnout situation. We need to support our doctors, nurses, lab techs, radiology techs, and everyone to be able to do their best job they can in a timely care. It is demoralizing to not only patients, but to our frontline workers when they are not listened to and nothing changes. On top of everything, Island Health knows that not having timely care can result in bad outcomes. That dramatically increases the cost of care, except when that results in death. In other words, timely care saves lives and money. Island Health has a plan to hire 14 ER trained nurses to open the ER 24/7. How long will that take? In the meantime, Port McNeill Hospital is overburdened at night and often ends up holding more patients than they are equipped to handle because there are no beds available down island. The delivery of medical services is being decided primarily in Victoria and to some extent Campbell River. Perhaps while Island Health is working on their ideal plan, we could look at other models that seem to be working. Gold River has access to emergency care 24/7 with less staff. This was community-driven and planned many years ago. We have enough competent and willing doctors in the town of Port Hardy. Perhaps we can engage them with feedback on providing medical care in an isolated community. This is about community-driven solutions, and all levels of government and the health authorities need to listen to the communities. We cannot wait any longer to see progress in opening Port Hardy's emergency department 24/7. The Ministry of Health and Island Health needs to be transparent and accountable. What are we doing to fix this? Empty promises without progress are no longer acceptable. The sooner the emergency department opens, the better. The appreciation of the people of this town made that aspect of working here so satisfying for Peter and I. We have never forgotten that. I will continue to advocate for Port Hardy Hospital to be a fully functional hospital that provides timely care. This is a priority for me, and I will not stop advocating for this to happen. I encourage everyone to continue advocating for this because we are stronger together. Thanks for everyone here today. You are all making a difference.
Thank you very much, Dr. Kindy and Kayla in her stead. I would now like to welcome our Honourable Mayor Pat Corbett-Labatt, who has the difficult job of representing a community with the longest emerge closure in Canada. Thank you very much.
Hello, everybody. And it has been really challenging. Thank you, Chief Knox, for the welcome to the territory. It's very much appreciated. As mayor, and I've got some council members here, we are totally aware of how frustrating and how concerning having limited ER hours are for our community and for our neighboring communities that rely on Port Hardy Hospital. We hear you and we share your concerns. I want to make actually before I go on to my speech, I do need to clarify something. And thank you, MP Gunn, for the shout out for our celebration last night, the Festival of Lights. The mayor and council have totally in support of it, but it was volunteers. It was a Festival of Lights volunteers and the Rotary Club that put it on, and we just got to partake in it. So it was an amazing event, and those of you that didn't get down to it still can see the lights. Okay, another clarification. Those of you that don't know this, the District of Port Hardy doesn't operate the hospital or manage the staff. ER department operations are managed by Island Health in the province of British Columbia. We can't hire doctors, we can't hire nurses, we can't hire lab techs, we can't hire x-ray techs. We can't open the ER on our own, and as everybody said, we've got to work together, we've got to advocate together, and that's what we've been doing. Before I tell you some of the stuff that we have been doing to advocate, I just wanted to express our absolute deep gratitude to all the healthcare workers that continue to care for our North Island every day. We want to thank the doctors here, the doctors at Island Health. We want to thank the nurses. We want to thank the pharmacists. We want to thank the pharmacy assistants, the physiotherapists, whether they're private or at the hospital, our lab techs, our x-ray techs, our protective services, our cleaners, the administrative staff. It's huge. It's a huge corporation, and they're all working so hard for our healthcare system. As well, thank you to the families that support them. So some of the positives that we don't want to know or want the community to know, that every single person on the North Island, thanks to Island Health and to the Community Health Center, have a family physician. We are one of the few areas in BC that has access to a family physician. There's, I think, 2 weeks ago when I was at a health summit, 6,000 people still do not have access to a family physician in BC, and that number might be low. And it's because of strong recruitment efforts. But what we do not have are trained ER nurses, and we do not have enough lab techs, and we do not have enough x-ray techs. And that's why the ER is not open 24/7. If you remember back in 2023, Port McNeill, Port Hardy, Alert Bay were getting constant notices the ER is closed. Sometimes overnight, sometimes all day, sometimes it was Port McNeill, sometimes it was Port Hardy, sometimes it was Alert Bay. Everything was precarious. So the Rural Coordination Center, doctors at BC, they all got together and had a 2-day summit here in Port Hardy. And there was physicians here, there was nurses here, there were elected officials, there was Island Health, there was private docs, there was people from all over BC that came to this, talking about what can we do together to make it more consistent. That's why our ER is not open in the evening, to make it consistent. Benefit, it is consistent. People know from 5 o'clock at night to 7 in the morning, we have to go to Port McNeill.
If you make it. If you have a heart attack or a stroke, you may not make it. And I know
So I cannot talk to that. I'm just saying we know what's going to be open. You're not going to arrive at 6 o'clock at Port Hardy anymore going, the doors are locked. You know it's going to be locked. So it's consistent. I don't like it. I don't like it. No one likes it. But that, we know what's happening. And so that's why that has happened. For also, Alert Bay is not open in the evening. They have it even more challenging because the ferries end, they have to get a water taxi or the helicopter. We have amazing first responders in our paramedics that have a high level of training. We have a full complement of paramedics, so that's helpful. And again, we want our ER open 24/7. As Mayor and Council, we meet with Island Health, we meet with the Minister of Health, we meet with Emergency Health Services and the Provincial Health Service Authority, and we are advocating. We want our ER open 24/7. We are also advocating, even for the short term, to extend our ER services even to 7 o'clock at night, because we know many accidents happen over dinner time. Hopefully that will happen soon. We have advocated for improved emergency transport options, so we've got a brand new ambulance in town. So there's 3 ambulances, so when the paramedics have to transport someone, they can. But as well, we've got a helicopter service that are taking people down. And I was talking to a new grandma yesterday whose daughter-in-law just had a baby and was transported by, and the baby was, I think, a month early, transported by helicopter down island to Nanaimo to have the baby, and everybody was, no one had to travel in the back of an ambulance. And the baby's healthy and in time for Christmas. We're recruiting and we're helping, but we all know we want to have safe staffing levels. We want to be, not only the doctors at the hospital to feel safe when they're dealing with their patients, we want patients to be safe as well. So some of the stuff that Island Health has done, and there's a press release. I printed off some copies of their press release if anyone wants to see it. It's also on their website. But through our advocacy, we're seeing some major provincial investments. That $30 million that came to Port Hardy in the North Island, we're the only community that got it. We're the first community that's had a mobile CT scanner coming up here, and it's been well used. We have to share it, but it's been well used. I'm sorry, you can shake your head. These are good things. It makes the people safer.
I realize that. I've been advocating for 4 years, but I've had Zoom meetings with Island Health, and anyways, I won't worry about it.
So I'll continue, and then, so that mobile CT scanner, we're the only one. I've had mayors from other communities asking, how did we do it? So that's a great investment. We have security, and people think, oh, why would we have security? We want our nurses to feel safe, and unfortunately, not all the health professionals feel safe in their work environment. We didn't have security before. The staff housing, although it's taken a lot longer, is coming because everyone knows we have a very low rent and as well houses for sale. So these houses will be opening in the next month or so, and will really help with not only the traveling nurses, doctors, and other health professionals, but will also help if they're coming up here permanently to give them time to find somewhere to live. We're looking at hospital upgrades, and that should be a really big recruitment enticement. Just because our hospital, those of you that have been around as long as I have, that hospital is over 40 years old, and we still call it our new hospital. But it needs upgrades. It needs to have the services for the doctors and other physicians or other health professionals to make use of. Right now, there are over 35 healthcare vacancies in our region altogether. So you know it's affecting recruitment. We have so many vacancies. So we've got enough physicians. Island Health is training ER nurses. They're the first hospital to train in-house in BC. Usually to train an ER nurse, they have to go to BCIT. They've trained 6, I believe. A number of them have stayed. And now it's not a pilot project, it will be ongoing. So I just want to say, we want to keep our ER open 24/7, absolutely, but it has to be done safely. I do want to also mention how important it is to keep our discussions constructive and helpful. Negative or bad narratives can unintentionally make it harder to recruit the very healthcare workers that we need to get our ER open 24/7. So as mayor and council, we have worked hard to strengthen our community by increasing local events and supporting local events. We've expanded our recreation programming. We've partnered with various organizations around the North Island to have more events. We're trying to make Port Hardy vibrant and as welcoming a place for people to live, to work, and raise their families. So, we're committed. We want it open 24/7, but we want it to be done safely. We want to improve access to every resident of the North Island. Those of you that come to our council meetings or read our council meeting minutes or view the recordings, see that we're talking about this every single council meeting. We talk about it at our regional, Mount White Regional Hospital District meetings every month. Every week, I'm talking health. I'm doing what I can, our council's doing what they can. So thank you very much.
Thank you very much, Mayor. We're in the home stretch, so just all together, less than 10 minutes to go. We've got a word from our doctors. As mentioned, Dr. Priyan Armagan is working Emerge today in Port McNeill. He'll be working past 5 p.m. when what he called the gates of hell open, when Port Hardy closes and all our patients get shuttled down to Port McNeill. And I'd just like to take a quick sec for a round of applause for Dr. Priyan Armagan. More than any doctor I've ever met, and I've met a lot of doctors, Dr. Armagan has been an outspoken advocate for the North Island. And so now I'd like to read a few remarks that Dr. Armagan has prepared. Friends, neighbors, and elected officials, my sincere regrets for not being here in person today. I address you as someone who lives with the realities of our health systems alongside all of you as a member of the community who happens to be a physician who's had the privilege of caring for this region for the past 20 years. We are here today because we care deeply about our families, our elders, our children, and in the future of healthcare on the North Island. It is important to recognize that the frontline staff, the nurses, the paramedics, the physicians, the care aides, laboratory staff, imaging staff, clerks, cleaners, and so many others who keep this system standing are often doing so at great personal cost. They are not the problem. They are the reason we have anything left to fight for. Our concern today is not with the people providing care, but those directing it. We are here to call out a pattern from health authorities and the Ministry of Health that has gone on for far too long. A lack of transparency, a lack of honest, timely communications with the public and community leaders, and a lot of rhetoric about quotes-unquote staffing challenges and quote, doing everything we can, end quote, without a clear, credible plan or effective use of the resources that do exist right now in the region. We keep hearing that, quote, recruitment is difficult, and that, quote, this is happening everywhere, and that, quote, change takes time. What we don't hear are the straight answers to simple, reasonable questions, such as, how many funded positions are actually sitting empty? How many shifts are going unfilled each month? Why are local resources and local clinicians not being fully and fairly used? Where exactly is the money going, and what outcomes are being measured? You cannot keep telling a community, quote, we're doing our best, quote, if you refuse to show what their best actually looks like. We are told there is a plan. If there's a plan, then share it. Put it on paper. Show us timelines, targets, and who is responsible for what. And if there's no plan, then at least be honest about it. And invite the people who live and work here to help build a plan. Because here is the truth. You cannot run healthcare for rural and remote communities from a boardroom in Victoria or Nanaimo and then act surprised when people feel abandoned. You cannot talk about, quote, partnership and, quote, engagement while decisions are made behind closed doors with community leaders and local clinicians barely informed after the fact, if at all. You cannot talk about, quote, equity in healthcare while smaller communities are left to live with chronic instability, rotating service cuts, and a constant sense that we should just be grateful for whatever scraps are left. And we're certainly not asking for miracles. We are asking for respect and honesty. So today, Dr. Priyan Armagan and all of us are asking for 3 simple commitments from all health authorities and from the Ministry of Health. First, real transparency. Publish clear, understandable information about staffing, service levels, and closures in our regions, and keep it updated. Not spin, not talking points, but facts. Number 2, a credible plan with timelines. Not vague promises of, quote, working hard or, quote, ongoing efforts, but specific steps, dates, and responsibilities. What will be different in 3 months, in 6 months, in 9 months? And how will we know? Meaningful in partnership, number 3, meaningful partnership with local communities. That means involving local physicians, nurses, First Nations leaders, municipal leaders, and residents before decisions are made, not after. Use the talent, knowledge, and commitment that already exists here. The community is not the problem. The community is the part of the solution that we are not using. We have skilled clinicians who want to work here. We have leaders who want to collaborate. We have residents who are willing to step up, to advocate, and to help. What we need is a system that stops hiding behind vague language and starts working with us, not around us. To our federal and provincial representatives here today, we are asking you not to just listen, but to act. Use your position and to demand honesty and accountability from the health authorities and from the Ministry of Health. Ask the hard questions on our behalf, and don't accept answers that sound good, but have no substance behind them. To the health authorities and ministry officials who may be listening, we're not here to embarrass you. We are here to remind you that you are in a position of public service. We are parents and grandparents. We are patients and caregivers. We are taxpayers and voters. We are the people who call this place home. We do not want to fight with you. We want to work with you. But partnership starts with truth, and truth starts with transparency. So today, from Port Hardy and the North Island, our message is simple. No more empty reassurances, no more polished statements with no details, no more decisions made about us without us. Give us facts, give us a plan, give us a seat at the table, because we are not going anywhere. This is our home, these are our hospitals, and these are our lives. Thank you, Dr. Priyan Armagan. And again, thank you for Dr. Armagan for looking after us, this whole region tonight, Friday night. It's going to be a busy night in Port McNeill Emerge. Finally, I'd like to just close. I'd like to thank everyone who's come here today. Your enthusiasm, your intention, your caring matters. This North Island Community Health Center is built on people who care. From our cushions on our seats, to the chairs that were donated by Hardy Boys, to the work that was done to build it. I'd like to briefly close by asking you all to think about responsibility and what it means. As a physician, I have a clear responsibility to my patient, to advocate for my patient's health, to care for my patient with the best available medical evidence, and to do my best in the practice of medicine. I will make mistakes, but I take responsibility. Too often I meet politicians that lose sight of their responsibility. I'd like to read a brief quote by Dr. Rudolf Virchow, who was a pathologist in the 19th century. "Medicine is a social science, and politics nothing more but medicine on a large scale." I'm a doctor. I love my job. I will never go into politics, but I will always fight for my patients. I wake up every morning at 4 a.m., and for 2 hours I work on advocacy work before I start working and caring for patients. I ruffled the mayor's feathers the other day because she got a text from me at 5 a.m. That's reality. This is my life. I care for my patients and I care for my community. I'm asking for accountability. I serve as a board member for BC Family Doctors, and I'm an incoming representative for the Representative Assembly for Doctors of BC. The just elected today President of Doctors of BC is a close friend of mine. We are not going anywhere. We are getting our Emerge open. And Emerge... We could split hairs, but, and I speak, quote, a mentor of mine, Dr. Alan Drummond, who's run and been spokesperson for the Canadian Association of Emergency Physicians, CAPE. An Emerge that closes at 5 p.m. is not an Emerge. It is an urgent care center, and we need to be clear in our definitions. There is universal truths. We need an Emerge in Port Hardy. We cannot allow regression in our healthcare system. We cannot slide backwards. We heard Dr. Anna Kindy talk about her and Dr. Olson working here in the 90s as family doctors. We've got the support of the Chamber and businesses behind us. We've got lots of support. I'd like to close by just citing another mentor of mine, Dr. Richard Horton, who's the editor-in-chief of The Lancet, which is a premier medical publication in the world, based out of the UK. I did my medical training at McGill University in Montreal. In my first year of medicine at McGill, I had the occasion to meet Dr. Horton. He came to our Osler lecture. This was a famous lecture that's gone on for over 100 years at McGill, and I will never forget his words. He was clear, he looked right at us as medical students and said, "You're not doing enough. People are suffering. You need to strip yourselves naked and chain yourselves to the gates of the Dean of Medicine. You must do more." My message to all of you today in closing, we must all do more. We need to get our Emerge open. There's no time to waste. With that, we will close today's rally. Welcome to stay and discuss. We're going to transition. We've got a little bit of time with our Member of Parliament, Aaron Gunn, that's going to be in our common room here. If you want to have a dialogue discussion, I will facilitate it, and you're welcome to join. Most of all, thank you for caring. Apathy is boring. Care.
Care for human life.
Thank you, Alex.
Thank you,
Alex.
We've got our number one fan, Anita.
I just want to say, I'm in my home, I don't get out much, so I'm probably the loneliest person here. But I've been advocating for 4 years for our health care, and I just want to say, if you want to be involved, don't send emails to our MLAs and our MPs, send actual letters. I've sent dozens of emails to Dix when he was in, EB, who hopefully is out soon, and many other MLAs, MPs and stuff. If you don't send letters, you can type them out, but sign them, then they'll get back to you, they get read.
And it's free to mail.
Yeah, and it's free to mail.
And it's free to mail. Okay.
Yeah, thank you.
You know, we've got a group here. Is there anyone else that would like to say a few words? I know Misty does. Anyone else? Okay. We're going to transition to the dialogue with Aaron Dunn. Thanks, Cal.
Kill Bill 66 before it is on, because we don't want our doctors bullied. Work with public and private facilities. Cover the overhead for the private doctors. They can bring in doctors. If you don't want to do it, guess what? Our doctors can. And we want the bullying stopped, and I've heard it from all kinds of healthcare workers up and down the island and on the mainland. Like I'd like to see, and a lot of people would, Kathy Williams gone, Ben Williams gone, James Hansen gone. We need someone in there that will work with the doctors. This is a healthcare crisis in BC.
Yeah.
We do have enough doctors, we do have enough nurses. They don't want to.
Unfortunately, our current government, which we know who,
Yep.
no change will happen until that government is dissolved.
I agree 100%, and I have sent dozens of emails to Davey over the years. I've had one response. He turned me. He said, pass the buck, go get a hold of Dix. So I wrote Dix dozens of times too, and I had one response.